Good evening. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. I am pleased to welcome you to tonight's webinar on HPV vaccine, cancer prevention for youth, which is being held in collaboration with Friends Health Connection. Human papillomavirus, or HPV, is the most common sexually transmitted infection in the United States. During this webinar, we will learn more about HPV, its risk factors and causes, and how it is diagnosed, as well as treatment options and prevention strategies, including vaccination. We are joined this evening by Dr. Amanda Francis, an obstetrician gynecologist at Robert Wood Johnson University Hospital, Somerset, and RWJBarnabas Health Medical Group. We will begin today's webinar with a moderated discussion followed by questions from our audience. And should you have a question for Dr. Francis, please post those in the Q&A section of this evening's webinar. So Dr. Francis, thank you for joining us tonight.
Thanks for having me.
So I'd like to start by having you tell our audience a little bit about yourself, if you don't mind.
As you said, I'm an OBGYN for they just changed the name, RWJBarnabas Health Medical Group, and I deliver at Robert Wood Johnson, Somerset, and Somerville. I also do trans care at the Proud Center, and I am the site director for the OBGYN medical school, the OBGYN medical student rotation for Rutgers Robert Wood Johnson Medical School in New Brunswick. I've been practicing, I graduated from residency in 2016, and I do obstetrics and gynecology, like I said, in addition to the other things I mentioned, but yeah.
Well, great. Well, thank you for joining us. I know you bring a host of knowledge and expertise to tonight's topic, so thank you again. So let's start off by talking about HPV. What is it and how prevalent is it?
So HPV is a double-stranded DNA virus, and it only infects humans. HPV has been around as long as human beings have been around, Homo sapiens have been around. It can cause different types or genotypes of HPV can cause different medical conditions. So we typically refer more to the high-risk types when we're talking about cervical cancer, but the low-risk types are the types that can cause genital warts. There's also some other low-risk types that can cause cutaneous warts, or warts just like on your hands, non-genital warts basically. So in 10% of children, their warts are HPV related. So typically you're seeing these warts in kids in the age of 12 to 16. They're not only in kids, as many as 3.5% of adults have non-genital warts at any given time. And how do you get warts on your hands? Through close personal contact. Like I said, genital warts or warts that are seen on the genitalia are caused by low-risk types of HPV, types 6 and 11. The studies that we have say we have a range of prevalence and ranging from about 1 to approximately 10%. And, the peak prevalence occurs in persons ages 17 to 33 years of age, with the peak incidence or the new infections typically happening in ages 20 to 24. And like I said, HPV type 6 and 11 cause about 90% of these genital warts. Other types of HPV related disease, much more serious, like we talked about, was cervical cancer. Over 90% of cervical cancer is caused by these high risk types of HPV. We also have HPV high risk type causing anal cancer. So and we're talking specifically HPV type 16 and 18. So nearly 90% of anal cancers and precancerous anal lesions are caused by HPV type 16 and 18. Penile cancer, also caused by these high-risk types 16 and 18. Approximately 30 to 40% of penile cancers overall are caused by these types of HPV. We also have oropharyngeal cancer, or cancer basically in the oropharynx region. you have HPV associated cancers and HPV or non-HPV associated cancers. The HPV associated cancers are going to be younger population. Sex is a risk factor for these types of cancers. Obviously, we're not as much as interested in the non-HPV related ones, but that's another type of disease that you can get from HPV. So we have non-genital warts, genital warts, anal cancer, cervical cancer, oral pharyngeal cancer, penile cancer as types of diseases that can be caused by HPV.
Wow. So dare I ask, are there any other health problems that cause this?
Not really. That's enough, right?
So because you're an OBGYN, I have to ask this question. How can HPV affect somebody who is pregnant?
So like you mentioned at the very beginning of the webinar, that HPV is the most common sexually transmitted infection. So most of the population has been exposed, if not had some, and we talk about most of the population, unfortunately, the only portion of the population that can actually be tested is someone who's had, unfortunately, a lesion in any of the areas we've discussed that was concerning for cancer, was biopsied and sent to a pathologist, or women who are able to and of age to be screened for cervical cancer. So with pap smears. So we don't have just screening tests for anyone. So there's a subset of the population that is only eligible for for screening, and then like I said, for testing in general. But I kind of got off.
So we were talking about HPV and pregnancy.
Right. So pregnancy, how would you even know that you had it in pregnancy? So again, women are lucky enough to be able to be screened for HPV and pap smears. If you were to have a pap smear prior to pregnancy and you had a pap smear that said that you had been exposed to HPV, that wouldn't have any bearing on your pregnancy. If you were to have a genital wart as a result of an HPV infection in the past or during a pregnancy, it wouldn't, again, have any bearing on the management of your pregnancy. Most genital warts are very, very small. Most people identify them when they're very small and take steps to have them removed. Even if they aren't removed, again, like I said, typically they start out really, really small and they take a little while to grow. So even if, let's say that you went for your first visit for pregnancy and you are identified to have genital warts, that wouldn't change the management of pregnancy. So obviously, when we're talking about cancers, that's different. It would depend on the stage of cancer in terms of how we would treat it and where you were in your pregnancy and things like that. But are there treatment options for HPV related cancers in pregnancy? Yes. It doesn't automatically mean that the pregnancy needs to be terminated. But that's obvious. That's definitely something that we are concerned about, which is why, pap smears are not dangerous for pregnancy. You should always, if you haven't had a pap smear and it's indicated at your first visit and you find out that you're pregnant, it's perfectly safe to have a pap smear in pregnancy.
Okay, so just a clarifying question. You were mentioning when somebody initially goes for their first visit, they're pregnant and they find out that they have HPV. Are they then given treatment for the HPV? So
if you were talking about warts, we typically, you can use topical treatments. They're plant-based resins that can help reduce the size of, depending on how large they are. But, the most commonly identified, first identified lesion size is usually amenable to these plant resins. Again, it's not going to affect the pregnancy. It's not going to hurt anything. Some women, anytime you take medications in pregnancy, it's a risk benefit scenario in terms of, do I want to take this potential risk? You're not going to find any long-term studies on most medications, the use of most medications in pregnancy. So if you were to identify, let's say that you went in for a treatment for an HPV related genital wart and you were to find out that you were pregnant, that wouldn't necessarily change the treatment plan if you choose to, continue with that pregnancy. That being said, if you were to defer, because they grow so slowly, if you wanted to defer the treatment until postpartum, that wouldn't, again, change the management of your pregnancy, and it wouldn't necessarily change the how those warts would need to be managed postpartum.
So then would a woman be able to deliver vaginally or?
Absolutely. The only contraindication to vaginal delivery with genital warts would be warts that were so large that they completely obstructed the vaginal opening of the vaginal canal, or, you know, if there was warts on the cervix that were so large that they obstructed, you know, they didn't allow the cervix to dilate because, you know, this entire cervix was distorted by a lesion. Again, these would have to be very large lesions, typically not found in the United States, usually places where there aren't rigorous screening programs like we have here.
So, and baby couldn't get, you know, HPV as passing through canal, right? So let's talk about how it's spread too in that scenario, and then going a little bit broader.
Right. So HPV is, you know, in general spread through skin to skin contact. That doesn't necessarily have to be sexual intercourse. Sexual contact is a more efficient way of spreading it, but you can, like we talked about, warts can be spread through skin to skin contact. You know, genital warts can be spread through skin to skin contact, not necessarily sexual intercourse. Can a baby get HPV from delivering through a vaginal canal that had warts in it? No. The baby does sit there for some time, but typically not long enough to be exposed to have an infection. Yeah.
Okay, great.
We wouldn't ask you to have a C-section. We wouldn't recommend a C-section because if you had genital warts, no.
Okay, thank you. Now, earlier you talked about kind of who was at risk, right? I think you said 9 to 16. You know, there's lots of different information out there. You know, we've heard 9 to 26. So could you clarify who is most at risk for HPV?
Well, everyone is at risk who's having any type of skin to skin contact with someone who potentially have the disease. So, you know, the approved population, the approved age for vaccination starts as young as 9 years old. Part of the reason for that is the highest efficacy or the highest effectiveness in the vaccine being able to prevent HPV related disease or infection is patients that are what's called HPV naive or who've never been infected. So we know that HPV is the most common sexually transmitted infection. So for people who've never had any contact with anyone who's had HPV, those people being vaccinated, they're more likely to be younger because, you know, the average age sexual intercourse, you know, depends. We don't have any real data on, you know, how young, you know, the average age is for, you can imagine how difficult that study would be. But the reason why the age is so young is because they're trying to identify patients that have populations that have the least likelihood of having any type of sexual contact. And, you know, but not as young as, you know, as childhood, but typically around, you know, the age of menarche or pubarchy typically is around, can be as young as 9 and still be within the realm of normal.
Okay. And again, just to clarify, like what causes it? You mentioned the skin to skin contact. Is there any, you know, other reasons or causes of HPV?
Besides sexual contact and skin to skin contact?
Yeah.
No, I mean, it's pretty broad, right? I mean, you can get HPV even if you're having, so we already covered sexual intercourse, so oral, vaginal intercourse, anal intercourse, you know, if you're having contact with someone who has HPV, like said, genital warts, if, you know, like fingers or like sexual toys, you know, those are ways that you can get HPV. Other than, I mean, sharing a glass with someone who has HPV, typically, you know, you don't, like if you're touching something that someone else that had a wart touched, no, it's still skin to skin contact would be the minimum.
So it couldn't be like a towel exchange, right?
No. It has to be some type of skin to skin contact. Yeah. Okay. Like I said, the best way, the most efficient way is, like I said, through sexual intercourse, you know, anal intercourse, you know, definitely a more efficient means, but at the very minimum has to be some skin to skin contact.
So you're coming into contact with somebody who's already infected with the virus. Okay. So, and again, I think you touched on this too, signs and symptoms, what to look for, what should individuals look for?
Right. So outside of warts, there's really not any other signs and symptoms to look for other than we talked about the other types of cancers or precancerous lesions where you're looking at something like in your mouth, or if you're a male, if you're looking at something on your penis that looks like a skin lesion that's not normal. So other than the things that would typically tip you off is like, this is something that's not normal, I should have this looked at, and genital warts, there's really not any signs of, which is again why this is such a common sexually transmitted infection, because most people don't have any symptoms at all.
Okay. So then how does a healthcare professional diagnose it? Okay, somebody comes in, they say, hey, I think I have warts. Do you just say, okay, or do you run any tests? Can you maybe explain that?
So with a lot of sexually transmitted infections that present with lesions, cutaneous lesions, vulvar lesions, vaginal lesions, it is by looking. So if you're looking at something on yourself and you're wondering, how am I going to know what this is? You need to visit a physician, particularly someone who has the expertise, because it's like, oh, let me go to MediMerge. MediMerge is great, it's convenient, but you're not always going to get someone who has a wide knowledge base. They're usually primary care providers. So if you're looking at something on your genitals, you probably want to see someone like myself, a gynecologist, or a urologist if you're a young male, or like if you're looking at something in your mouth on the base of your tongue. Primary care providers can be helpful, but dentists can also be helpful in that respect too. Not necessarily oral surgeons. That's kind of a difficult appointment to get, but someone that you can access would be, the first person to access it would be, like I said, a primary care physician for, like I said, oral lesions. Like I said, if you're dentist, they're very knowledgeable about lesions in the mouth as well. But in terms of diagnosing lesions, like I said, we're looking at them. There's not really tests that we would do. There's no tests for genital herpes or for, warts that we would find, like cutaneous warts.
Okay. No blood work or anything like that. Correct. So, okay. So now you go to a doctor, right? Physician, and they diagnose and they said, yes, this is HPV. So what are the treatment options available to individuals?
So for genital warts, we have, like I said, a lot of different options for topical treatments to decrease the size and the projection of warts. Those treatments typically take many weeks, at least 6 to 8 weeks minimum. So it's something that you're going to be following up with and using for some time. Some of the, so when I say topical treatments, like I said, plant resins, acid, these are all prescription medications. So again, you're going to need to find a doctor who can prescribe these medications and also help you to, instruct you on how to apply them, because it is going to be a long-term process. There's also, we're also talking about warts, laser removal. Not as common because, again, in the United States, we have such a rigorous screening program. Most people have access to care. They're able to identify these lesions at a smaller size. So there's just not the utility for the laser removal, because most people are able to identify them early on and use topical treatments. So, but that is a possibility. Laser removal is possible for, like I said, for larger lesions, typically that are over a centimeter. Other treatments. When we're talking about precancerous lesions of the cervix, there's certainly treatments that would be dependent on biopsy and biopsy results and pap smear results to determine to what degree the abnormality of the cells are, and if there's any cancer present versus, like I said, precancerous lesions. So, but there's a lot of treatment options for these precancerous lesions and even these confined cancers. So again, that contributes to why the prevalence of cervical cancer and the mortality rate for cervical cancer in the United States is very low.
Okay. Well, thank you. Those are great options. Now, on the flip side, on looking at preventing HPV, like we talked about, it's skin to skin contact. So, no sexual activity.
Right. Exactly. Nothing. Not even really sexual activity. Just, when we talk about sexual activity, again, we're typically talking about, oral sex, anal sex, vaginal intercourse. So if you're someone who wants to, get to know someone, as a manner of speaking, but not engage in those activities, you're still putting yourself at risk. If you're even, like I said, again, engaging in mutual masturbation or sex toy play or manual stimulation. Again, these are still things where you're coming into skin contact with someone who has been exposed and putting yourself at risk. So the best way to prevent really is vaccination. Again, when we're talking about patients in the population in the ages of 9 to 15 who typically have yet to be exposed, they're the people that have the greatest benefit from the vaccine in terms of the highest likelihood that they won't be infected on subsequent exposure because they're being vaccinated prior to having any contact.
So I'm going to hold off on the vaccine just a second, but for prevention, are condoms an option?
Condoms are helpful, like we talked about. I mean, sexual contact isn't a very much more efficient means of transition, but like we just were mentioning, there's other ways of having, contact with people that doesn't involve, coitus or, vaginal intercourse. So if you're not doing that, or if you're someone who's not interested in that type of sex, then you still are at risk and you're not able to use that. So it's like, there's people talk about dental dams or other type of barrier methods. Again, that's a good idea. And, I think anything that decreases your risk is helpful, but, nothing is 100%, anytime, again, like you're having skin to skin contact, you're going to be, I think what the takeaway from that is a lot of patients, when we have these testings done, specifically pap smears, and they come up HPV positive, I've encountered a lot of significant distress about, I can't believe this is happening to me. I can't believe I have a sexually transmitted infection. How am I going to live my life? And it's very distressing, and I always open with what we discussed what you mentioned, Serena, in the very beginning. This is the most common sexually transmitted infection and over 80% of the population has been exposed to this virus because most people don't have any symptoms. It is transmitted so easily, and it's been around as long as we've been around. So it's hard. If you're a social person, it's hard. It's going to be hard for you to not be exposed.
Yeah. So, now let's go back to vaccine. So you mentioned vaccine is one of those ways we can, hopefully prevent. So let's talk about, and I think you mentioned a little bit about who can get vaccinated,
right?
Who can get the HPV vaccine. So can you again clarify, who qualifies for it?
So the vaccine we're talking about is the HPV vaccine. It's the trade name is Gardasil. It is a non-valent, meaning it protects against 9 of the types of HPV most commonly found in cervical cancer in the United States. Now, we also mentioned before that even though we talk a lot about cervical cancer, HPV causes other types of disease that we mentioned, specifically other types of cancers that are not just affecting people who have cervixes. So the people who are eligible for the vaccine are people as young as 9 years old, both male and female, or people who are assigned male and female at birth are both eligible for vaccination. You get it between the ages of 9 and 15, then it's 2 shots. The second dose is at least 6 months after the first dose, and that's it. It doesn't require boosters or you just have those 2 vaccines and that's it. The next group, so if you're over 15, then it's 3 shots, and we don't have any other age breakdowns. It's just either 9 to 15 or over 15. So over 15 years old, it's 3 shots. You have the first shot, and then the next shot has to be at least 2 months later, and then the third shot needs to be at least 6 months after the first shot. The American College of the American Community of Immunization, or Committee on Immunization Practices, recommends that even if, let's say, because it's 3 shots, you're kind of in a formative time of your life. If you're not sure if your parents got you all 3 shots, or maybe you're getting ready to go to school and you got the first shot, but you kind of got, pandemic and, being your first year in college, things got, a little hairy. You can resume your schedule. Let's say, I know I got my first shot. I'm not really sure if I got the second or third shot. you can resume your vaccination without having to restart. So you don't have to start over again with the first one. You can just get the second and the third one. It's not going to hurt you. You're still going to have, there's some coverage from just getting one shot, but obviously the ideal scenario is you completing the series and having all three if you're over the age of 15.
So, and again, just to clarify, so what you're saying, like if you start your first shot and like, okay, let's say you missed the time frame.
Right. So like I said, there's a minimum time frame. So you get your first shot and the next one has to be at least 2 months afterwards if you're over 15. If you get it 2 years later, as long as it's been at least 2 months, you're still gonna get that benefit. Granted, like we were talking about before, the most benefit to be gained is if you are getting these vaccines prior to being exposed. So if you start intercourse at 15 and you get your first shot at like 14, then that's gonna factor into but it's still some protection versus none. It's not going to be nearly as much once you've been exposed, but that again, if you're exposing yourself to someone who's never been exposed, then that's different.
And then I just also want to ask another clarifying question. So you mentioned, under 15, 2 doses, over 15, 3 doses.
Correct.
Why is that?
The difference between the dosing schedules, probably because of like weight distributions, again, exposure, the likelihood of exposure, kind of like when they're talking about like with COVID vaccines, the dosing of like boosters versus the first injection, it's the same. The maturity of the immune system, physiology, because that's basically what we're talking about, pre-puberty versus post. Once you get to be like around 12 to 15, you're basically an adult in terms of your physiology, physiology of immunology, things like that. So probably doses related to that, the difference in just physiology between children, the pediatric population versus an adult.
Okay, thank you.
Also, immunocompromised patients would need 3 doses as well.
Okay, thank you for that clarification. Mm-hmm. Now, how effective is the vaccine? What is the efficacy, if you will?
So like we were saying, if you're someone who's never been exposed, it's as high as 97% effective in preventing HPV infections. Once you've been exposed and your age increases, so exposure and age are 2 separate factors that can work against you, primarily because one is is associated with the other. The older you are, the more likely you are to have more exposure. So it can decrease to as much as 20% in the older population. So we're talking about, you mentioned in the beginning that the age ranges changed, from, teens to up to 26, and then now it's up to 45. So while we aren't finding as high as protection or efficacy in our patients in the 26 to 45 population, we are still finding a statistically significant decrease in cancers related to HPV infection. So not unlike the COVID vaccine, it's not that you're not going to necessarily not be infected, but you're less likely to have a serious complication once you're vaccinated.
And thank you. I was just about to ask you about cancer prevention in terms of the vaccine. So I appreciate clarifying that. So again, if somebody wants to go get this, one of the things that commonly comes up with our community or community members is something like this covered by insurance?
Absolutely. Up until, like I said, the FDA recently approved, I think it's 2016, that women aged 26 to 45 can get or FDA approved to receive the vaccine. I think it's only recently that insurance has started to catch up. It's been 6 years. So insurance covers all preventative health measures, including vaccines. So if you're someone who's over the age of 26, you should be able to get, like I said, we were starting as young as 9. So eligible population is age 9 to 45. So if you're interested in getting the vaccine, you're under the age of 45, your insurance should cover it.
Okay. So I know this is, I think typically, and correct me if I'm wrong, this is not one of those vaccines that schools require. So often.
That's actually a lot of undergraduate institutions, Rutgers being one of them, do require HPV vaccines.
Oh, yeah. That's good to know.
Yeah, that's a lot of the times the way I find out with patients when I'm asking about their vaccine status. It's like oh, I'm not really sure if I remember getting it. And then I talk about the pre-admissions process when they were filling out their health forms, like, oh yeah, I remember I had to get it because blah, 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 school. Yeah.
So one of the common things that comes up is this a safe vaccine?
Absolutely. Absolutely. So the populations we talked about, 9 is as old as 9 years old and under, 45 and under are the eligible population to receive it, both male and female, assigned male and female at birth. But we don't recommend it. So while immunocompromised people can get the vaccine, we do not recommend it to be received during pregnancy. So those are the only, people that we were saying are not eligible outside of the requirements that we've already discussed. But yes, it is a safe vaccine. Other than having, soreness in your arm, there's no other side effects. Like, a lot of times with, again, our most ever present vaccine example is the COVID vaccine. So mild symptoms of COVID that people have mentioned after receiving their shot or their booster, again, not the case with HPV vaccine, just, soreness at the site.
Oh, great. All right. Well, thank you. So now if somebody wants to get the HPV vaccine, where do they typically get it? Is that through their primary care physician's office? Yeah.
So I would say the first place, depending, would be determined by your age group. So if you're in the 9 to 15 age group, definitely your pediatrician's office. They have all the vaccines all the time. So that's a great place to go. Gynecologists typically have it. Primary care physicians, it depends on their population, right? If you're a family practice physician or someone who sees, who does a lot of care for, like primary care for children as well as women, then you're more likely to have, then a primary care physician would, like a family practice physician, be more likely to have it than like an internal medicine physician who only saw like an older population. That being said, health department is a great resource in finding out where you can get vaccinated.
Okay.
Planned Parenthood.
Yeah, very good. All right. So at this time, I'd like to open it up to questions and answers from our audience. If you do have a question for Dr. Francis, please post it in the Q&A section of our webinar. I am seeing that we do have one here. This audience member's child was diagnosed with molluscum
contagiosum.
Yeah, just put molluscum on his arm and legs. Is this related to HPV? And,
no.
Okay, because this person was told it was similar to warts.
Right, yes, in terms of the appearance, but no, it's not related to HPV.
Okay, very good. Let me see if there's any other questions. One of the things that has come up, again, if you could clarify, what is the latest age somebody could get the HPV vaccine?
The limit is 45.
Oh, so you can go up to 45 to get the HPV vaccine.
Mm-hmm. Like I said, it was FDA approved, and I believe 2020, it might have been 2018. But sometime between 2016 and 2018 was when it was FDA approved to go up to 45. And like I said, it's only been recently that I've been seeing people getting more likely to get it because insurance has been covering it. It takes a little while for insurance companies to catch up with the latest recommendations for preventative health changes that come out.
Okay, very good. Any other questions for Dr. Francis? I'm not seeing any other questions, Dr. Francis. I think you must have answered all of their questions during our conversation. So if there are no other questions for Dr. Francis, then this will actually conclude tonight's webinar. So thank you, Dr. Francis, for giving us an overview of HPV and what we can do to protect ourselves. And thank you all for joining us this evening. Please remember that the information presented here by our medical expert is not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral service at 1-888-724-7123. And for more information on services at Robert Wood Johnson University Hospital, Somerset, please visit us at www.rwjbh.org/Somerset. On behalf of RWJ Somerset, thank you again for joining us, and please be well. Have a great evening, everyone.